So as we discussed, frequent bladder infections is more than 2 in 6 months or more than 3 in a year. And patients do not want that. Once you have it, it's like PTSD. Please, I don't know when it's going to happen. And when it comes with a vengeance. So you got to help me with this, doctor. So when they come to see me, we rule out any cause. Once the cause has been ruled out, what can be done? Now, if there is vaginal atrophy, that means thinning of the vaginal lining. See, what could happen is, as you can see here, normally the vaginal pH is acidic, 4.5. The bowel pH is 7, so it's neutral to alkaline. So the bacteria will never be able to come forward because of the acidic pH of the vagina. However, once estrogen diminishes in a postmenopausal woman, the vaginal pH becomes the same as the bowel pH, which is 7. And now the bacteria can move forward. And as you can see, there's not much clearance. Even the urethral pH changes and the bacteria can hang around in the urethra. And soon they can get pushed into the bladder. There's not a huge distance to travel, the urethra itself being only 4 centimeters long. So within a couple of centimeters, they're in the bladder, and now they cause mayhem. They cause a major bladder infection and all the symptoms of a bladder infection. So if there is postmenopausal atrophy and the vaginal pH has gone up, we can quickly check it up with the pH paper. And if that is so, vaginal estrogenization may be beneficial. Now, this is especially good if a patient is also complaining of dryness and discomfort during intercourse. It can get 2 birds with 1 stone. So by making the pH acidic, and again, bringing the pH to proper number. What happens is, once you give estrogen, the lining of the bladder, of the vaginal wall, starts excreting or secreting glycogen that gets converted to lactic acid. And once it's converted to lactic acid, that maintains the low pH of the vagina. Once that is the case, the bacteria cannot move forward, and this would therefore help with bladder infections in a postmenopausal woman. Estrogen therapy, therefore, in certain cases helps with prevention of bladder infections.